Ensara TV ekerenga kiomogusi.
My names are Dr. Robert Pukose, Member of Parliament Endebess and Chair Departmental Committee on Health. Honorable Chair, I want to present the budget. I'll begin with the supplementary estimate for the Ministry of Health.
What you do, Chair? Eh?
I just will go to observations.
No. Observations only highlight.
Okay.
You know, members, let's make sense of the time. The recommendations, the observations we had from Honorable Tongoyo. What do we do about it? Basically, other than hearing, and we can read after. I think the main domain in this committee is recommendations.
Okay.
So you may just highlight the critical observations, then specifically go to recommendations after very critical observations.
Thank you, Chair, for your direction. Honorable Chair, the Departmental Committee on Health considered the supplementary estimates 2 for the year ending 30th June 2024 and made the following observations. Under the State Department for Medical Services, in the current financial year, the State Department has approved a budget of 106.1 billion, comprising of 65.9 billion and 40.2 billion under the current and development budget. The absorption rate for the actual expenditures at the end of third quarter is at 75.8% for recurrent and 67% for development. And the State Department is fast-tracking implementation of programs to ensure 100% absorption rate by close of the financial year. It should also be noted, Honorable Chair, that the disbursements have not been consistent, and that it could be is what is affecting the absorption. In as far as the State Department for Public Health and Professional Standards, the approved estimates have been revised from Kenya shillings 28.2 billion to 28.6 billion. This includes 6.1 billion for capital expenditures and 22.2 billion for recurrent expenses. This shows an increase in the current expenditure of 391 million and capital expenditures of 12.3 billion. Honorable Chair, following that observation, the committee, having reviewed the proposed 2023-2024 financial year estimates number 2 for the State Departments and having engaged with the health sector stakeholders, recommends the following reallocations within the sector. The first one, I think if you in this document, we go to page 42. On social protection in health, we have a program called Rollout of Universal Health Coverage, which has 9.9 billion. So we've reduced 1 billion, and the reason is that the Social Health Authority is still in the process of enlisting indigents into the social health, into the medical insurance shift, and therefore may not be able to absorb the entire allocation between now and close of the financial year. The second one is we have a program, construction of health centers, where they had proposed allocation of 400 million. The committee recommended reduction of this 400 million. This is a new project and therefore may not absorb the entire allocation in the financial year 2023-2024. When we move to the next page, under preventive and promotive health services, we have the Kenya National Public Health Institute, and therefore we've recommended an increased amount by 70 million. This is funds for implementation of Kenya National Public Health Institute strategic plan. As you are aware, the head of state has signed bilateral agreements with the CDC at London, and therefore we need now this organization to start moving. Then the next one is Clinical Officers Council, where we've recommended an increase by 10 million. This is funds for personnel emoluments, shortfalls, and operationalization of Clinical Officers Council. Then we have the next one is the anti-snake venom processing plant facility. This is the Kenya Institute of Primate Research, where we've allocated 300 million. This is funds for local manufacturing of snake antivenom. Manufactured antivenom will be commercialized and thus generate revenue for the SAGA. The institute will provide antivenom for the Africa region and the world. Currently, most of the anti-snake venoms are imported from India and Europe, and therefore this will now be able to save us. One, it will save the country from importing anti-snake venom, and two, it will also be able to generate income. And as you are aware, there are regions within this country that we have issues of snake bites. The third one is the Kenyatta National Hospital, where we've allocated 70 million. This is funds for the procurement of the backup generator at the referral facility. Basically, this is to support the oxygen plant that is being installed in the hospital. Next one is construction of tuition blocks and laboratories at KMTC. This is construction of Kianyaga KMTC 50 million, Chuka KMTC 30 million, Band Forest KMTC 30 million, and the Kolomani KMTC 40 million. These are projects that these are facilities that are among the 21 KMTCs that we needed them to be operationalized. Thank you, Honorable Mille. Then the next one is 100 million for pathology and forensic services. This is to the government pathology, and these funds are to cater for the government pathology department, which has been undertaking its work in Shakahola, death cull since April 2023, and the 100 shillings will cater for domestic travel, subsistence, and other costs, specialized materials and supplies, fuel, oil, and lubricants, and other operating expenses. I think you are all aware of the Shakahola issue, so I don't need to elaborate further on that. Then, pardon? Shakahola in Kilifi. Then we have construction and upgrading of Kemri laboratories. This is additional funds for construction of Kemri laboratories at Kirinyaga, 50 million, Kemri Kombewa, 50 million. And then we have additional funds to the headquarters. This is to support implementation of the approved structure by Public Service Commission as State Department for Public Health and Professional Standards. Then we have additional funds for establishment of 313 primary healthcare networks, the 400 million which we removed from the other side. I think basically that is my presentation for the supplementary.
You can proceed to the estimates, to the main, then we'll ask questions after.
Thank you, Chair. Thank you, Chair. Chair, on the report of the consideration of budget estimates for financial year 2024-2025, the two votes for 1082 for the State Department for Medical Services and for 1083 State Department for Public Health and Professional Standards, I want to take you to page 65 of this document, and in which we'll look at the observations. On the general observation, the committee had received quarterly reports submitted by the Ministry of Health as at the end of March 2024, pursuant to our standing orders of 216(5)B of the National Assembly. And the purpose of the Ministry report was to inform members on the budget implementation. It was, however, noted that the ministry report was not comprehensive and lacked critical information on the implementation status of the ministry projects. I now go to the State Department for Medical Services. Following deliberations between the national government and the Council of Governors in relation to the Managed Equipment Services project, it was agreed that the county government shall be required to initiate a transparent process for procurement of their own equipment. However, as a stopgap measure, the existing contractual obligations were negotiated for extension up to the end of March 2024, and in the financial year 2024-2025, the project has been allocated 3.5 billion, and this is basically to sort out that extension period between April 2024 up to April 2023 to March 2024. The committee observed that there were delays in reimbursement of funds for services rendered through the Linda Mama program by NHIF. Mental health is underfunded both at the county level and the national level. The Ministry of Health and Kenya Medical Practitioners and Dentists Council entered into a return to work formula agreement to end the doctor strike. The committee noted that the resource requirement for the agreement had not been factored into the financial year 2024-2025 budget. For instance, 3.5 billion salary arrears for the CPA 2017 has not been budgeted for in the 2024-2025 financial year. Kenyatta National Hospital has handed off Mama Margaret Uhuru Hospital to County Government of Nairobi, and the staff working for the Annex Hospital will be redeployed to Kenyatta National Hospital and also to Othaya. There is no consolidated budget line for cancer research in the country, and the National Cancer Institute resorts to using foreign data due to lack of funds to commission cancer research in the country. G, the Vaccine Alliance, that is CAFI, has been supporting Kenya's vaccination program since 2001 by providing vaccines and related supplies worth 98.2 billion. Notwithstanding the government's effort to provide universal access to vaccines to all populations, the CAFI program ends in 2027. And as you are aware, there are areas where we are now experiencing shortage of vaccines within the country. The committee observed that the Ministry of Health is in the process of elevating Jaramogi Oginga Odinga Hospital to a national referral hospital. The funding by the national government will ensure that the facility operates at optimal levels. However, the committee observed that there are no legal framework or guidelines anchoring this engagement of elevation of county hospitals to national referral hospitals. And once Jaramogi Oginga Odinga National Referral Hospital is gazetted, then I think once it has its budget line, we'll be able to present to this committee. The Ministry of Health and Social Health Authority is still in the phase of transition and operationalization of new Social Health Insurance Act 2023. The Social Health Authority planned to undertake mean testing and registration of all Kenyans into Social Health Insurance Fund. On the State Department for Public Health and Professional Standards, the slow Exchequer release has told the operations of the 21 KMTC campuses in the 2023-2024 financial year, and many of you, honorable members, you are aware you have KMTCs which needs to be operationalized. However, KMTC has started recruitment of staff for the 21 KMTC campuses. The Kenya Medical Practitioners and Dentists Council is expected to undertake fresh accreditation of health facilities in preparation of lowering out of Social Health Insurance Fund. The facilities will be required to have met KMPDC quality standards to be empaneled as service provider under the Social Health Authority. Kenya Medical Training College was penalized 721 million by National Social Security Fund because of accrued contributions that were unpaid for the period 2002 to 2011. And my appeal to this committee, I don't know how that can be sorted out because it's a penalty. The payment of community health promoter stipend is a shared responsibility between the national government and county governments. The two levels of government agreed to pay the stipends on a matching basis. The committee noted that 27 counties had paid their stipend, while 20 counties had not honored this obligation. Community health promoters working in counties of Vihiga, Tana River, Marsabit, Mandera, and Garissa had not been trained, and therefore the equipment is lying idle for the last 7 months. Further, the Mombasa and Nyamira counties submitted excess community health promoter names for payment. And lastly, the Kenya Health Human Resource Advisory Council, established under the Health Act 2017, and mandated to review policy and establish uniform norms and standards on the management of interns and medical specialists in the governmental transfers, county to county and between two levels of government, welfare and the scheme of service for health professionals, and maintenance of master register for all health practitioners in the country is not yet operational. Therefore, the committee made the following financial recommendations. The Ministry of Health should engage the technical officers in their sagas in the preparation of the quarterly reports, and in preparation for final budget estimates for financial year 2024-2025, the National Treasury creates separate budget lines for the following sagas: Spinal Injury Hospital, National Public Health Institute, Kenya Tissue and Transplant Authority, National Quality Control Laboratory, and Kenya Human Resource Advisory Councils. Honorable members of the Budget Committee, these institutes, there are already sagas that have been gazetted, but their budget line is being operated from Afya House, the Ministry of Health headquarters. And with the Ministry of Health headquarters operating their budget, what it means is that they procure what the institutions might not require, and therefore they end up with the commodities which they don't require. If they have their own separate budget line and accounting, then they'll be able to procure what they need. And you'll find that many of the CEOs of these institutions go to now Ministry of Health to start following on vouchers and procurement process, which should be domiciled within their own sagas, as they are gazetted as distinct sagas. On State Department for Medical Services, I just want to now go down to financial recommendations on the table, beginning on page 68. Do I need to go through that, or I just leave it, because that's the reductions and the increments which we've done?
You're referring to the table?
Yeah, the tables which are there, which we've done reductions, and I think the committee can go through it.
Yeah, you can skip that.
Okay. So, honorable members, I think
67.
that is my submission.
68.
And if there are no questions, I can leave Murongaru to.
Honorable Atand.
Chair, thank you very much. Chair, I have a few concerns. The first one is, Chair, in the morning we were attending a mediation meeting for division of revenue between the Senate and National Assembly. And one of the issues that emerged has to do with your department, that you are engaged in many activities that are ideally are supposed to be devolved. And that is the reason why you are keeping so much money in your ministry, in your department, that should go to the counties. One of which was the resources that you are budgeted for community health promoters. Because you have said that this is a partnership between counties and national government. The senators are asking you, why can't you hand over this money to the counties so that it forms part of the allocations to counties? Because you are just keeping the money and sending them to be paid by counties? Why can't it go direct?
Ask how much is it?
How much? And first of all, how much is it? I was told it's about 20 something billion.
2.5 billion.
2.5 billion. That is one. Two, you've mentioned about Jaramogi Oginga Odinga Referral Hospital, which is supposed to be upgraded to level 6. And you are saying that you are waiting for gazettement. I want to urge you, Mr. Chairman, that the allocations towards that should be put in this budget. Because this is long overdue. That hospital is a regional hospital that serves both Western and Nyanza. And cases of referral from as far as Ugenya, Alego, they are taken to this hospital. And this hospital requires enhancement, Suba, not everything. So we want to urge you, in the spirit of equity, in the spirit of national equity, let us work towards upgrading this hospital to level 6 as soon as yesterday. And thank you for that. Let me.
Honorable Nyakundi.
Thank you, Chair, and thank you, Chair, for the elaborate presentation. Mine goes to the CHPs, as Honorable Atandia said. In my county, the CHPs have never been paid for the last 6 months, the Kisii County, and they have never used those kits ever since they were given those kits. I wanted to know, has the national government released the money for CHPs to the counties or not? And how much has already been released to the county government? Thank you. Last one is on the cancer center. In the supplementary budget, I don't know if the cancer center is still there, the money for the cancer center.
It was in the supplementary we've removed, but in the main budget, it has been returned because of it's donor funding.
Yes,
and
yes.
Therefore, it could not be absorbed between now, but now we've put it back on the next financial year.
Thank you.
Okay.
But Millie, your hand was up, then now I'll come this side. Thank you, Chair, and let me just thank the Chair of Health for such a comprehensive report. Chair, I just wanted to find out, you have indicated in the supplementary increase in capital grants for equipping KMTCs, but you said the list is not provided. So does that mean you have no clue which these KMTCs are? That is one. And secondly, I also just need you to clarify, there was money for a hostel for Mbita KMTC. Has it been removed in the supplementary budget? That is true. Then the other question I'd like is in relation to the free maternity program, if you confirm that there's a reduction and why, and especially because we know that it's been removed completely. Has it been removed completely or has it been reduced? It was the last financial year, it was
4 billion.
4.
The next 2 years, so it's 2.
So now it is 2. Yes, maybe if you can explain why, because we know that that is something that really helps our women and reduces maternal deaths. And then also the other issue is on the vaccine program, which is actually at 0, if you can confirm if that is the case. Again, why is that so? And then, again, on the procurement of family planning and reproductive health commodities, also seems that there is a reduction again. And why is that? Why is it that the things that are beneficial to women are the ones being reduced? Again, the family planning, maternal and child health program, again, there is a reduction from, I think in the last budget it was 23,686,737. Now it is 13. So there's also a reduction. Why is it that the things that are really reducing maternal and child deaths are the ones that we are targeting. Is it that we want our children? So not from us. Okay. And then I just wanted, pardon? No, I'm saying what is the reason why they don't know? Okay, you'll give us the reason. Then the other issue that I wanted to, again for Jaramogi, the same concerns, because even if you put it in the budget, really making something legally operational where there is a will does not take 2 days. But I wanted to also find out in the same manner, it's really good that we are coming up with regional cancer centers in Kakamega, Meru, and I think Kisii. Yeah, is it possible that we also consider Homa Bay, because the cases of cancer are completely alarming. So for me, I think those are the ones that I wanted for now. Thank you.
Makali, then Mashako, then Honorable Jamatia.
Yeah, thank you. Thank you, Madam Chair. Honorable Chair, I want to have two issues.
Yeah,
one relates to
yeah,
the supplementary budget.
Yeah, and I come to you.
In your reallocations, you have reallocated some money to KMTCs. These are many of them. They are Chuka, Burnt Forest, Economani, and all that.
Can you just read all of them? That would be nice.
Are these new?
Once you answer when you are
So
time.
the question I'm asking is that what you're saying justification is construction of Kianyaga KMTC 50 million, Chuka 50 million. So I was just wondering, in case it has not started, do you have the time, bearing in mind this is a supplementary budget, to do the construction in 1.5 months? That's the first question. The second question is just below that one. You are increasing the amount to pathology and forensic services. And then you have put that money as development, 100 million. But when you look at the activities, these are recurrent expenditure. So is it that you place the figures in the wrong place? Is that needs to be clarified? Then coming to the main budget, Honorable Chair, that is the proposed estimates. I think the issue of the medical, you call it what? This project, managed equipment services. Your report says there was a negotiation that the amount be the exchange be extended up to March 2024, the contract. And on the basis of that, you are saying you want to allocate in this current budget, the coming budget, 3.5 billion. So, if we decided to do out this project, this program in terms of contracts, so the 3.5 billion, is it a pending bill or what is it? Because we are discussing about the coming year. Then the other issue is, I just can't quickly through this thing. I remember when we were doing the last budget, I was looking for KMTC Kitui. I can't see it anywhere here, and I remember I raised that matter. I hope you'll be answering me where does it, which page is it in that one? Because I've not seen it, and I remember I raised this matter in the last budget. Thank you, Madam.
Honorable Mashako.
Thank you, Chair. My issues are quite a few. First is to again laud our colleague, Chair Health, for an elaborate and detailed presentation. I have 2 or 3 issues. One is what Mheshimiwa Mili raised, Linda Mama. The word out there is that this current Kenya Kwanza government has stopped Linda Mama program. And now here I'm seeing there's 2 billion that has been allocated. I don't know whether it's the same Linda Mama or it's a different program. Because out there, mothers are going to hospitals, they're paying their own bills as we speak today. Then number 2 is on cancer research. You've indicated in your report that there's no budget line on cancer research. Chair, I know you are a specialist in this area in terms of, you're a medic. We are losing a lot of our people from cancer. And I want to give you just a short scenario. In the Coast General Hospital in Mombasa, that's our main referral hospital in the region, 60% of cancer patients come from Taita Taveta, unfortunately. So the doctors there have been asking what is wrong with Taita Taveta. And some of us would want the government, even written letters to the ministry, to carry out a research around why the prevalence rates of cancer in our region, in Taita Taveta to be precise. And our population is small, Chair. So when I hear that there's no even budget line on cancer research, leave alone a research in terms of looking at what is causing cancer. Chair, maybe just for information, Taita Taveta sits on the Mozambique belt. We have gemstones, we have different types of minerals. So it is rumored that all the water we drink is laced with elements that cause cancer. So I want to bring it to your attention, Chair Health, that I'll be requiring your support to come up with a research that will identify areas in this country that are getting cancer cases at a very high rate. So this no budget on cancer needs to be looked at, and maybe this budget committee needs to find money and put money for cancer research. Lastly, Chair, is on KMTC. Recently, there was a policy issue. There was a pronouncement within the ministry that you will not be doing new KMTCs because until, or if you do KMTC, it has to get approval from I don't know who. So just wanted to check whether that is an understanding of the ministry, or we can continue doing KMTCs because this Kenya Kwanza government has been saying that we need to take people outside the country, and particularly nurses. So I think it's important we continue putting money in KMTCs so that we can train as much as our people for those medical jobs. Thank you.
Honorable Sorgon.
Thank you so much, Madam Chair, and thank you to the Chair of Department Health, who is sitting before us.